again, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me again on the podcast is Dr. Hope Argenziano, who is a rheumatologist here at Monument Health. Welcome back, Doctor. Thanks for coming in again.
Yeah,
and
no
let's
problem.
talk some more immune system. The more I think about this thing in our body that keeps us alive and protects us, I wish we could just have a conversation with it because it does a great job, but sometimes, like in our last podcast where we talked about rheumatoid arthritis, it gets confused.
Yes.
That's a fair statement to make about our immune system?
That's a perfect word, is it gets confused.
Okay.
But it's so amazing. It does so much for us. I mean, every day we're exposed to different things in our environment, and it's there protecting us.
And I know when we talked last time, one thing that stood out that I've been thinking quite a bit about is the fact that we talked about if there could ever be a cure for autoimmune diseases. And you said probably not, because you would have to find a cure for each individual because of our immune systems and how they work, correct?
Yes, and our immune systems, they're unique to every individual because every time they've been exposed to a virus or a bacteria, our immune system, it sees that as a threat. And at first, it doesn't know what to do with that virus. It's like, is that hope or is that something else? And it takes a while, and then it says, oh, no, it's not hope. We have to go ahead and we'll attack it. So different cells go to the virus, and they surround it, and they sort of eat it like Pac-Man.
Yeah.
And then at that point, it processes it, and it spits out all these little, what I like to call red flags, which are part of that virus. And those red flags, the next time that same virus come, the red flags swarm onto that bacteria or virus. So the immune system does not hesitate. It sees those red flags on that particular thing, and it automatically attacks. There is no hesitation. And that's how vaccines work.
Oh, excellent. That was a great analogy on how that works. That really explained it well. But like we said, sometimes it gets confused. And the topic that we have today is one that you are personally familiar with.
Yes.
And that is the topic of lupus, which I read today that sometimes it's referred to as the great imitator.
Yes.
Have you heard that before?
Yeah. And, sometimes as rheumatologists, we kind of, laugh because we'll say, well, if you line up 10 people with lupus in the same room, they'll have some symptoms similar, but you may not even think they have the same disease.
So then what exactly is it? Why is this such a weird autoimmune disease?
And I would say overall, because, for example, in the other podcast, we talked about rheumatoid.
Yes.
And rheumatoid, it's mostly a joint disease. You have inflammation in your joints, and we want to help stop disfigurement and disability. With lupus likes to attack other organs. So people think, oh, I feel tired all the time, or I'm just achy, I might have lupus. That's not even part of the criteria. So the immune system, when it gets confused with lupus, it can attack our kidneys, it can attack our heart, it can attack our lungs, it can attack our brain, and it does that with inflammation. Whenever our immune system attacks us, it triggers inflammation. So, of course, lupus patients can have an arthritis, but overall, it's mostly the organs.
So it's a much more serious conditions than something like rheumatoid then. Because inflammation of the brain or heart seems serious.
It is, and that's when the organs are affected, yes. And so, I don't like to categorize like one disease worse than the other, but yeah, absolutely. So when a person comes into their primary care, who is, like I said, the first lines, they're going to analyze your symptoms. But it's not the fatigue or it's not the achiness that, will trigger an autoimmune workup. It will be, I'm retaining a lot of fluid in my hands and my feet, or, I've been losing a tremendous amount of weight, or I'm getting fevers for no reason, or I have rashes on my body that I can't explain. I don't know what's going on.
So Well, this must be a hard, you've kind of touched on it a little, but this seems like a very hard question to answer what the most common symptoms of lupus would be then, because it seems like there's a lot of symptoms that lupus could be.
And just from what I said, I only scratched the surface.
Yeah. So, but are there some more typical than others that you see for this? Or again, is it, we just got to start the process?
I would say overall that could be tricky, because the reason that it took so long for me to get help with the diagnosis of lupus is because I would go into the military doctors and they would say, you kind of sound like you might have lupus, but you don't have the rash. So, the typical butterfly rash, and I never had that. And maybe around 30% of people might have the rash. Not everybody gets the skin manifestations of lupus. So, you really have to keep an open mind. But I would say, unexplained fevers, you get so sick, you do start losing weight for no reason, a lot of weight, and then at that point you might have the rash, but you may have fluid around your heart. So you may come in with chest pain. So it really is up to the primary care to kind of figure out what's going on, and then do one of the screening tests. And if the screening test called the ANA is positive, that's where they kind of like, whoa, with that, we need to get you to rheumatology to see if you in fact have a connective tissue disease like lupus. And not everybody does. Like I said in the last podcast, our testing isn't perfect.
Right.
If I lined up 100 people over the age of 65, about 35 or 37 of those individuals would have a positive ANA and never really have a connective tissue disease or lupus. So you have to have the symptoms and you have to have the lab work. It goes hand in hand. Just because you have that positive ANA, it's not like a pregnancy test where you have lupus or a condition like that.
Well, and what you described of chest pain, or, all of these, that could be a myriad of things. You could be losing weight because of cancers. You could be, like I said, the chest pains could be all kinds of heart-related issues.
Rashes could be psoriasis or eczema.
Right. Yeah. So you have to pair those two together, the symptoms with that test, in order to even to get started in this, is what
Absolutely.
I'm hearing.
And that ANA test that we have, if it's negative, it's very, very specific. That I can tell you with 99.5% certainty that you don't have lupus if that ANA was negative.
Wow.
There used to be something called an ANA negative lupus, but the testing has gotten so perfected and so good that if it's negative, we tell people don't do any more testing for lupus because it's probably not.
Okay. Are there different types of lupus?
Yes.
Really?
Yes.
So, oh boy.
So, it's lupus, but what we do is we categorize it as to what it's affecting. So some patients, they'll come in and they're coming in to me because they had a positive ANA, but their urinalysis shows that their kidneys aren't functioning. They're producing a lot of protein. Mm-hmm. So then we have to use medicines that help the kidney with lupus. Some people have a lot of the joint manifestations. A lot of people, can come in and they have more of the heart manifestations with something called pericarditis, which is inflammation around the heart. So not everybody, like say for example, if a person has the type of lupus that affects their kidneys, they may never have any joint problems. They may never have the rashes. So at that point, they don't need a lot of medicine for their joints. They need it for the kidneys. Some people just have the joint and the skin. Some people just have the inflammation in the heart. Some people just have seizures and neuropsychiatric lupus.
Can lupus ever be fatal?
Oh, of course.
Really?
Yes, absolutely.
I suppose if it's affecting the heart and kidneys in that way.
Yeah, and if your kidneys fail, or overall, if you have a seizure that you can't come back from, absolutely.
Oh boy. We talked a little bit about how you diagnose it. So let's get in then a little bit to the treatment options that are available for lupus. Again, this seems like it's so tricky to treat something like this, because you're going all over the body to find what needs to be treated.
Right. And usually, with our physical exams and doing some of the lab tests, there are lab tests that are disease specific for lupus, For example, there's a test called a double-stranded DNA, and if that's positive, we know we have to watch the kidneys because that marker is usually seen in kidney disease with lupus. There's another test called a ribosomal RMP antibody. So if that's highly positive, then like, wow, we have to watch the nervous system. Sometimes that can be in people who have seizures or they have the psychosis with lupus. So we do have clues with our testing as to what organs we have to watch for. There's a protein called RMP. If that's highly positive in a lupus patient, we know we have to watch the lungs.
Okay, so those are then what? So then it's just different treatments. I mean, you have to pinpoint what those would be.
Yes, because there's certain medications that are great for the kidneys, but maybe not so good for the joint manifestations.
Is it mainly medication that you take for lupus, or are there other procedures?
Hopefully a person gets in a timely manner to where medications can calm everything down. But if their kidneys are just not doing well, then they need dialysis.
Right.
Or if they keep getting inflammation around the heart and our medicines aren't helping, then they have to go in for certain procedures to get the fluid out of their heart and lungs.
So is lupus, is it genetics? Is it genetic in a sense, or is it a lifestyle thing too that maybe there are things we can do?
All autoimmune disease, you have a genetic predisposition with that, and it takes something in the environment to trigger. So that's the commonality. There are a lot of different autoimmune disease. There's MS, which neurologists take care of. There's Crohn's disease and ulcerative colitis that the gastroenterologists take care of. But the root is you have a genetic predisposition, and something triggers it to be activated and confuse the immune system.
So you could, if you would just lived a great life, you could go through your entire life having it and never have it triggered. But we all get sick. We're all going to have something like that happen. Mm-hmm. So it's just, but can you carry it and not ever have it activate?
I'm sure because there are certain diseases that I take care of where we actually test for the gene, like ankylosing spondylitis. That's an autoimmune disease that can affect the spine. And there is a gene called an HLA-B27. So if a patient has that, we know that disease is more likely. But do we go testing everybody for it? No, because there's a certain portion of people who live their entire life with that gene and never have ankylosing spondylitis.
Oh, okay. So again, lifestyle stuff. It always seems to be the same three, which we all should have beaten into our heads right now. Stop smoking.
Yes.
Number one, get rid of that. Eat better. Go for a walk at this point, right? I mean,
absolutely.
And those can all have an impact on either, not getting lupus, I would say, but if you have lupus, can they help? Can they be beneficial?
Oh, absolutely.
Okay.
I mean, absolutely. Any doctor who tells you that eating the right foods and exercising is not a benefit is wrong. So, yeah.
Okay. So if somebody is newly diagnosed with lupus, what advice do you give, or what resources, where do you point these people? What direction do they go after you tell them this is what you have? Here's what you're going to do.
Sure. And with that, though, I think that with lupus, a support group is fairly good.
Okay.
Yes. And Lupus Foundation, I was very active in St. Louis when I was, a fellow there, a training rheumatologist. And we did a lot of things, a lot of educational seminars, a safe place for the patients to get very good, accurate information and to share their stories. I gave a talk. I went back to St. Louis University and gave a talk for the Lupus Foundation. And I had so many patients coming up to me, and they're like, wow, I never thought that a doctor could have lupus. And they were surprised because I basically gave, my personal experience. And they're like, you were going through the same stuff that I was. And it was just almost shocking.
What were your symptoms? How did you notice?
I think a lot of mine were the arthritis initially because I was in a very physical job.
Yes.
So with that, overall, I started getting a lot of swelling in my joints. And then I started just dropping weight. I lost 20 pounds in 4 weeks.
Oh,
and I wasn't eating. I just felt physically sick. And then overall, I would go to the doctor and they'd be like, well, we can't find anything wrong. And then my kidney tests were off. And they're like, well, something's wrong with your kidneys. And so, but I didn't have the rash, so I couldn't have lupus.
That's right. All right. Well, all of this, again, is great information. Start with your primary care doctor, of course, if any of these symptoms pop up, correct? One thing, when I was looking into this a little bit today, too, I've always been curious about why they chose the word lupus for this specific disease.
Right.
Of course, it's the Latin word for wolf.
Yes.
Is where it comes from.
Mm-hmm.
And now, is it true that it was because it described the facial sores that like they said it was like a bite from a wolf?
Mm-hmm.
But what are they referencing there? Because you just keep talking about the rash, but is there something that looks like that in people that have it, or was it just from a long time ago? I mean, this was like 13th century, but
right. And this goes back to when you asked the question, are there different types of lupus? There is a type of lupus that is just on the skin, and we call it discoid lupus.
Okay.
And the Singer seal, that's what he has. And so that, when you think of the wolf and you think of what the Singer seal looks like,
yes,
that is pretty close to what you'll see. But with discoid lupus, it usually does not become systemic lupus, which affects the organs. Usually it sticks to the skin.
Well, when we talked in the last podcast, too, about rheumatoid arthritis, you said it's very symmetrical, meaning you'll get it on both sides of your body. But lupus obviously isn't like this at all. It can attack anything and just be a jerk about certain stuff, right?
Absolutely, yes.
Well, Dr. Hope Argenziano, thank you again. Rheumatoid. You're a rheumatologist at Monument Health. It's been great talking to you over these past couple of episodes, and you've made me feel better to know that because you said this is a field that's there's not a lot of you that are in this field, correct? In our region. So it's awesome that we have 2, maybe 3 of you here now soon at Monument Health that can help.
Right.
That's great.
Right.
So thank you very much for coming in and talking again, Doctor. And, I hope to do it again.
Thanks.